I want to talk about that and more with Dr. Richard Besser, the former acting director of the CDC, now president of the Robert Wood Johnson Foundation. Dr. Besser, good morning to you. I mean, when you look at the lay of the land in this country, in the last month, cases are up more than 5 times. Over the past 2 weeks, new infections have risen by 148%. I know a lot of people thought, wait a minute, I thought we turned the corner here. Just go back to basics here. Why?
Yeah, you know, Savannah, we all wanted to turn a page on the pandemic, and unfortunately the pandemic wasn't ready to turn a page on us. One of the things that's clear is that as long as there's widespread transmission of the virus, there's the opportunity for new variants to arise, and that's what happened with the Delta variant. Thankfully, it is covered by the current vaccines, but there's no guarantee that the next variant that emerges, it won't be one that the vaccines aren't effective for. So I'm really pleased to hear the reporting that the number of people getting vaccinated is on the rise. We can't give up on people who so far have not gotten vaccinated. We have to meet people where they are, address their concerns, and help them roll up their sleeves to get that shot.
But help people understand here, because I think it's really, really confusing. Essentially what the CDC has discovered, and correct me if I'm wrong, is that with this Delta variant, even if you're vaccinated, if you get a breakthrough case, and we've always known there will be some amount of breakthrough cases where you get the COVID infection, you just don't get sick, you can still be spreading it. And you can spread it just as readily as somebody who doesn't have the vaccine. Is that what you attribute to this dramatic spike in cases that we're seeing?
No, absolutely not. So while that is possible, it is possible to be a breakthrough case and to spread it. If you're vaccinated, you are so much less likely to become a case of COVID. Most of the transmission we're seeing is from unvaccinated people. What they're saying, though, is that even if you're fully vaccinated, the fact that this Delta variant is spreading so rapidly, you can't let your guard down. And you do need to follow your local guidance, wear masks indoors if you're in an area where there's high transmission. And unfortunately, each day that's becoming more and more of our country.
And the short answer is still get vaccinated. But the silver lining is where we started. It does sound like, especially in some of these hotspot states, these regions where vaccinations were slow, it does seem like it's ticking up. People are starting to get that message.
Yeah, and the other piece of this is that although the cases are rising dramatically, thankfully the highest risk populations, those over 65, those with medical conditions, have the highest vaccination rates. So we won't see the same incredibly devastating toll in terms of mortality that we saw last summer, last winter. We will see in places like Florida, where hospitals are overwhelmed, that some people with other medical conditions won't be able to get in for things that need treatment. And that shouldn't be. If people would do the right thing, get vaccinated, wear masks in areas where there's high transmission, wear masks indoors where there's a lot of transmission, we would see these numbers coming down. And hopefully we will see Delta variants start to decline like we were seeing in places like the UK that experienced this before we did.
All right, Dr. Besser, thank you as always.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.